Our stakeholders in the health sector are concerned about the impact of budget cuts at the Gauteng Department of Health. The Minister of Health has convened a committee to review the future of overtime for state doctors. Now, for some doctors, overtime pay has not actually been paid to them for the month of April. To tell us more on this, we're joined by South African Medical Trade Union General Secretary Dr Cedrick Sihlangu. Dr Sihlangu, thank you so much for the time. Appreciated. Can you confirm to us that some of your members indeed have still not been paid their overtime for the month of April? Are you able to share numbers in terms of specific number of members who haven't been paid?
Thank you very much, Arabile. Yes, indeed, we are faced with a peculiar crisis in the Gauteng Department of Health this time around, where at the beginning of this financial year in April, there was an intention to reconfigure this overtime dispensation for doctors. It's called commuted overtime. It's a fixed overtime that doctors have to perform on a monthly basis, and then they get remunerated as part of their salary. But there was an intention to reconfigure that. We felt that intention was without consultation with Labour. So we then met with the Gauteng Department of Health, and we agreed amicably to put a halt to that process, pending various processes and consultations, which they agreed. But subsequently, towards the end of the month, when doctors expected to receive their commuted overtime payments, as they do every other month, this time around in various hospitals, that amount did not come through, which was, of course, a very big concern to us, having actually had an agreement with the Gauteng Health Department that it can't be that when we agree on issues of mutual interest, then suddenly it's not implemented. And then we were told that there were glitches in the e-government system, which resulted in the non-payment of this overtime to doctors, which we find quite regrettable. Indeed, doctors in SMU, University, those who are linked to that complex, some were not paid in George Mukari and in other hospitals as well. So we then said, look, there needs to be urgent action to resolve this problem. Otherwise, we will withdraw labor, because remember, you can't compel somebody to work if you're not paying them, especially in an instance where we are still discussing the issues of the overtime contracts themselves. But the employers then said that they are speedily attending to the matter. Unfortunately, as it stands, some doctors have been paid in trickling formats. Others are still waiting for their payments.
When you question the department with regards to the non-payment, have they given you an update on when those payments will be made?
Yeah, initially they had said literally within, I think it was about 4 or 5 days. It was supposed to be from Thursday, it was going to be on the Monday or the Tuesday, but that never happened. Then they continued to say within the next 3 days. We have then given them up until the 15th to have paid all, doctors overtime. Otherwise, we are going to withdraw our labor. But let me maybe make one point to give you a bit of background. Unfortunately, Gauteng Health sits as a sentinel province, because if you imagine Gauteng referring to, Mpumalanga referring to Gauteng, Northwest refers to Gauteng, even Limpopo. If you look at issues of oncology there, we are heavily reliant on Gauteng Department of Health. So the failure of Gauteng Health is actually of national consequences. So I think our view really is that there needs to be a multifaceted approach in resolving the problems in Gauteng. And if you think about it, the system is infiltrated not only at a departmental level, at the head office. If you think of this being a failure of an MEC on HOD, I think you would have misdiagnosed it, because the problem seems to have infiltrated even in institutions. If you look at the situation in Tembisa. So in this particular instance, the HOD had given a directive. The circular was out that all doctors must be paid by this day, and it never happened. So it suggests to us that we need an intervention measure that is more looking into the entire system, and possibly even placing Gauteng under Section 101B administration.
Yeah. Further meetings, conversations that you'll be having with the Department of Health then in all of this, and also what does this mean then for patients, for doctors moving forward?
You see, Arabile, that's precisely the point we make, is that we don't want to have a situation where doctors don't perform overtime, where after hours you won't be able to have access to care, because that has dire consequences for the innocent public. where they will be having emergencies, then they get to the hospital and they can't be attended to. We make the point that Gauteng is very sentinel to the functioning of health in this country because of the various provinces that we rely on it. And if it means, and I repeat, if it means we might have to start considering the whole Gauteng administration being placed under administration in terms of Section 100, maybe that's what we need to consider, because the failures are just too many and they are ongoing. We know the Rahima Musa situation and many other institutions that seem to be having constant issues, constant failures.
So, Doctor, are you saying then that ultimately if they are unable to raise the budget and stop these budget cuts, particularly with regards to commuted overtime, then that you will look to try and get the entire government of Gauteng under administration if that needs to be the case?
You're well aware, they returned close to 1.8 billion to Treasury, which was unspent. I mean, it's embarrassing to think about it. When we've got patients that need oncology care, oncology services, Gauteng Health is now challenging the judgment from the High Court with regards to rendering oncology service, which it baffles the mind, really. Why would you want to challenge something that you are constitutionally mandated to provide? So those are the issues that, one then sits back and say, maybe we need to start thinking of a different type of intervention measure here, considering how the administration itself has been conducting itself.
Dr. Cedrick Sihlangu, unfortunately, that's all the time we have then this morning, but appreciate it. It's certainly a concern. We'll hopefully chat to you just after the 15th to get a clear sense of how things fare there and what perhaps the next steps will certainly be. Then Dr. Cedrick Sihlangu, the Samatu General Secretary there, joining us as the Gauteng Health Department incurs those budget cuts